So this is amplifying the voices of families from underrepresented communities. A couple of months ago, we did a presentation on outreach to rural and frontier families, and that was, engaging those families. This is taking it to the next level where we're trying to amplify their voices so that they have a voice in policies and on committees and in evaluation. And we're going to go through all of that here in just a minute, but that's the succession for these two sessions. So this is the NTAC disclaimer, knowing that the material that is in here is in the public domain, and you can use it. I don't think we have anything in this particular presentation that's copyrighted, so feel free to use it. And that's another reason we're recording, is because we didn't put a lot into the slides, because we want this to be more of a discussion area. Know that these slides and this presentation was presented or was prepared by me and Shannon and Anne as our presenters, and is not the what am I trying to say? It's not part of SAMHSA. They haven't. It's our opinions, and we represent it. So yeah. So a little bit about NTAC, who is very kind to give us the time for these presentations once a month. NTAC works with lots of different teams. These are all of the partners that NTAC works with. And their goal is to help all children, youth, young adults, and families with emotional and behavioral health needs can access evidence-based treatment and recovery services in a well-coordinated system of care. These are the people that we serve. We serve, or NTAC serves, not necessarily Fredla or where I'm from, but they serve state and local agencies, mental health workforce, school workforce, primary care providers, community-based providers, peer supervisors, and family and youth partners. And this is a nifty little visual of the services that NTAC provides. And so please, when you get this copy of this presentation on your email in the next couple of days, you can go back and look and see what they do. At the very end of the presentation, there are emails where you can contact NTAC if you are in need of any technical assistance or any support in any way, and then they will help you. Today, our presenters are Ann Smith and Shannon Crossbear, and I'm going to let them introduce themselves, and I'll start with you, Ann. Go right ahead. Okay, Shannon, we'll start with you.
Okay. Well, I hope Ann can join us. So just good afternoon, everybody. I just want to say a few words in my language. Anin Indaway Maganek. I just greetings to all of you as my relatives. I was using the Ojibwe language. My name is Shannon Crossbear. I'm an Ojibwe Irish woman from northern Minnesota, the homelands of the Ojibwe people, and I come to this conversation as a family member and as someone who has been in the work of elevating family voice and specifically helping to find supports and avenues for our indigenous populations and tribal peoples who are oftentimes not included in kind of the services and supports to the full capacity. So I'm glad to be here. I'm glad to be in conversation with all of you. And greetings. It looks like we have great people. Thanks for putting your where you're from and what your roles are in the chat box. That helps a lot. So I'll turn it over to Anne to introduce herself.
Thank you.
Well, thank you, Shannon. Thank you, Lori. And thank you to everyone who has joined us today and are still coming in. My name is Ann Smith, and I serve as the Executive Director of AFCAMP Advocacy for Children. We are located in Connecticut, and we provide advocacy, resources, training for parents of children with disabilities primarily, but recognizing that they touch other systems as well. We look at the juvenile justice system, general education, special education, and right now with the major focus on children's mental and behavioral health, we are very much involved in that. And so being able to do this work and be with us today to talk about some of the challenges that underrepresented populations face and some of the strategies that can be used, and we want to not only share amongst what we've done, but also to hear about some of the innovations that you all have been doing. So we're looking forward to this being an interactive, very informative opportunity to share. We hope to learn from you as well. So thank you so much, Lori.
Yeah, thank you. And as you know, I work for Fredla and work on the NTAC team as a TA specialist and come to this work with lots of years experience as an executive director of a family organization in Utah. So glad that you're here. And again, as Ann said, hope that you will be able to share information as well, because this is a real learning experience and we want to make sure that everybody gets an opportunity to share. So thank you. A little bit about our agenda. Just quickly, we've done the welcome and introductions. The purpose of the family exchange is just to bring together family leaders to talk about what issues are most important to you. And all of the topics that we have chosen come from the participants of the family exchange. So we're really excited to bring you information that's helpful. Then we're going to talk a little bit about, well, the rest of our day will be amplifying the voice of families who are underrepresented and talk about what role the family organizations play in that. And then we'll have some time at the end for questions and answers as a whole group. And then we'll debrief a little bit and talk about our next meeting, which will be in April. So the learning objectives for today are to purposeful outreach and inclusion. And what does that mean? We're going to talk about the definition of the family and the family roles, strategies that have been tried and what we learned from them, the role of the family organizations, and then we'll end up again with purposeful outreach and inclusion, because it's my new favorite word. So purposeful is my new favorite word. It is an adjective having or showing determination for resolve. And it is some similar words are determined, resolute, resolved, firm, steadfast, single-minded, and then having a useful purpose is how to use that. It's a purposeful activities. And then intentional is the best part of this definition. So all activities with families, no matter where they are located, should be purposeful. Families should fill influential positions at local, regional, and state levels across all child serving agencies that make decisions about policies and procedures affecting youth and families. And this can include serving on committees, boards, local interagency committees, quality control committees, etc. So some of those things we're going to talk about today, and I wanted to make sure that this becomes your new favorite word as well, because everything that we do should be intentional and purposeful. So just a family is defined by the family. A family takes on many different shapes and sizes. We've talked in the past couple of months about outreach to families, whether it be frontier, rural, urban, suburban. There is a uniqueness to each and every family. And families in whatever shape or size need to play a vital and active role in their own treatment plans. But families must also have a say in the development and implementation of plans that are unique to their own strengths and needs. Our discussion today is to talk about how to help families, especially those in underrepresented communities, go to the next level and helping to determine what the service delivery looks like, be involved in management of systems of care, and have their voices amplified in order to make policy decisions that reflect their family and those in their communities. As we explore strategies today, you'll hear some recommendations from our guest speakers who have unique experiences in helping the families from their communities to be heard. But I want you also to be thinking about ways that you too can be purposeful in amplifying the voices of families that you serve. Okay, so Anne, this is your slide. You're on mute, Anne.
What we know is that families are sometimes the only constant in their children's mental health system experience. We know that there are any number of providers who might interact with our children and with our families as they are seeking services to address their needs. And sometimes systems do not appreciate the role that the family can play in creating continuity across all of those different stages of the service process. We have to find ways to successfully engage families. And the way to do that is to go above and beyond what the traditional ways are, what we have always done. At the same time, it calls for us to change policies, protocols, and processes.
Wait a minute. What? Successfully engaging families requires us to go above and beyond relationships. Look at my sweat marks.
Oh, you're working hard.
And when we're doing that, when we're looking at those policies and protocols, the goal should be to encourage, support, and sustain an investment. And you're investing not only in the systems, but we're investing in the individuals, in the family members, in those who know best what the needs of their children are. So the system will tell us that we will do assessments and evaluations, and those are going to tell us what it is that our children need. They can be helpful, but definitive guidance is also provided by families. And so they should be key participants in the process at every stage.
Very good. So what roles do families play? And I've separated them into these three areas because that's the way system of care language separates them, but they certainly don't need to be categorized only in these areas. So if you've got other ideas, please feel free to put that in the chat so that we can all learn from your experiences in your area. So in service delivery, we think families should engage or be engaged in the decisions about their child's care and ensuring the continuity of that care like Ann just talked about. They need to provide key information, or they're the only ones who can provide that key information for their treatment goals and the key elements of the plan of care. They can either receive or be trained to be a parent peer support. In the management area, we think that families should identify challenges and quality of care issues. They can be part of and should participate in the parent peer support training and education. And they need to actively participate in quality of services and evaluation efforts. And in the policy area, they need to actively participate on policy boards, committees, local interagency councils, and I'd be happy to hear anything that you have to add to this, either Ann or Shannon. Any other roles that you know that families play?
Yeah, thanks, Lori. I think that's a pretty good list. I think we all tend to think about how, we engage families in the actual treatment, the actual intervention. At that level, we're always talking about engaging families. And we forget that there's a lot that goes, that there are so many of these other roles that are equally important. And that families are like the rest of our communities, and they have, in addition to their experience, they have a set of skills that they bring to the table, and they're a vital part of our workforce in being able to deliver services in a variety of different ways. And so, I think keeping that in mind of what does it take to actually to engage families. And one of the things that I think of is that this is not whether families should do this but rather what are the opportunities that we're not families should be doing this, but it's what are the opportunities for families to be able to participate fully in that continuum of roles and activities. So if that makes sense to folks.
It does, thank you. And anything you'd like to add?
So I really agree with you, Shannon. And I think that one of the challenges that we face is that oftentimes it is difficult for professionals to extend the level of recognition to family members and parents as contributing members of the team. And it requires a mindset shift. And so it's not just professionals who can bring to the table information that is critical, helpful, and can really contribute to the effectiveness of the outcomes of any treatment plan.
Very good. We had an ad in the chat that said for these roles to work, providers need to recognize the importance and skills they have in dealing with their children. That is so absolutely true. Families have to be told that they are the professional on their child. And we talk about that a lot, and it does take that mindset change that was just mentioned. Thank you. We're going to go into some discussion now, and in this discussion time, I'm going to stop sharing my screen so that we can all be together and we can participate together in, now I have to figure out how I change. Okay, well, I don't know how, oh, there, okay. We're good, we're still good. This is a new thing for me. Okay, so does this on my slides, or did I stop sharing that?
We're all in one room now, Lori. We're not.
Perfect.
seeing
I
slides.
am not with you. I don't know why, but that's okay. That's just fine. First question that we have is how can we encourage and support families in these roles? Shannon, I'll start with you and then we'll go to Anne.
Thanks. Just as I was thinking about that, I was thinking about that such a perfect kind of follow-up to what was being said, is that before we even start to apply kind of all these other things, we have to know kind of where we're at, you know, collectively in your agency and your organization, and the, you know, are these the whole idea of having families participate, is that in these different roles, is that even a part of the way that people think? Or are they still at a stage where, you know, when we think about the processes of change, are they still in the stage of just thinking about it? Or have they committed to it? Or do they feel like they have to do it because it was written somewhere? And where are they at with all of that? Because that really comes to play before you even think about what specifically are we going to do to include families. And then you layer on top of it the conversation that we're having today, which is, and how do you engage those families that that may not be as represented in our family voice, right? So I don't know, I probably got way off your question, Lori, but I don't know, it's where my thoughts went. So
You're great. Thank you. Anne?
In line with what Shannon has just shared, taking a look at our systems, those that are providers, taking a look at your agency, looking at whether there are any cultural, linguistic, or other types of barriers that might be keeping some of the populations that are underrepresented. What we need to do is take that internal look at the agency and say, let me step back a little bit and see, are there things that we are doing that we could change that would encourage and support families to feel more comfortable, to feel more valued, and to be treated as more important contributors to the care team. So it really does take looking at things, not only with a different mindset, but applying a different lens when you look at your agency.
and I just want to say that, you know, I kind of looked at some of the different roles that people that are joining today, and thinking about in your position, you know, your particular role in your particular position, you know, that's another kind of lens to put on, you know, kind of leading from any chair and thinking about you know, our family voice. And the reason I say that is that sometimes within the systems of care or other initiatives, when there's a call for a family voice and folks don't know how to do that, so they go to a family organization. But if our family organizations are not doing the outreach to include families that are not represented, or, you know, really not doing that very, as Lori said, intentional, purposeful outreach in order to get that, be able to allow avenues for that family or for that voice to emerge, then we're still missing the, you know, we're not going to see a shift until kind of all the players are contributing to making that happen, if that makes sense to folks.
Very good. And you can see from the list of people who have put their name in chat, how many roles there are that families can play. Let's talk about what some of those roles are. What are some other roles that families can play? Any, Anne and Shannon, will start with you, and then if anybody else wants to be involved, you can either put your questions or your answers in chat, or we can, you're welcome to unmute and join us vocally. So,
Thank you, Lori.
you're
And,
welcome.
Before we get to that, I just wanted to call attention to a comment that is in the chat that I think is really critical. When
Okay.
we're talking about taking a look at the agencies, this commenter says providers need to step back and view the involvement they think they have with families versus what the families think. And this is just really getting to the crux of the matter, because many times taking a look at it internally, an organization will say, well, I'm doing a pretty good job. And we do have a question somewhat during this presentation to ask people how well they think they do it. But then when you ask those who are receiving the services how they think you're doing, it's sometimes a very different perspective and result. And so that's a really important comment. I'm thanking the individuals that made that. But in terms of the different roles that the parent and families can play, I think one of those roles that's really key is they can provide data. They can provide information that a screening tool or an assessment might not necessarily uncover. And I think that that's particularly true when we have assessments that do not relate to the cultural values of the family. And so it can be, there can be some difference in terms of how the family views a particular behavior or incident and how the provider might take a look at it. So the role that I think families can play is that they can put a lens on the assessment data that can put it in a context in which the child lives and in which the child is really entrenched and is relating to. And so the family can provide important data, because there could be other cultural standards, stimuli, and other impacts that won't be picked up necessarily in an assessment.
And in the chat, Michelle says that caregivers are the experts. And oftentimes we don't recognize that, or we don't remember that we are the experts, but we definitely are the ones who know our children the best, right? Some other family things that Lisa had put into chat, other family roles, is advisory councils, SOC meetings, system of care, or system partner boards like NAMI. So yeah, there are other things that Families also fill the role of the protector. I'm reading that in the chat, and financial and emotional support provider. Critical things for families to do. Absolutely. Okay, so the next, let's see, screen. I'm going to come back to my screen for just a minute, to the slides. And we have a poll in, let's see, in the next one. So the first question is, what have been some of the efforts or strategies for engagement in the past that we can learn from? So again, we'll go back to Shannon and Anne. And Shannon, what are some of the efforts or strategies that you have used that you have learned from?
In terms of engaging families, Lori?
Yes.
Okay. So I think, that's a great question, and it's a really broad question, and I'll say that because it depends on where I'm looking for that engagement to happen, right? So, but overall, when I think about engaging, and I'm specifically thinking about engaging our tribal populations, that some of the ways that family organizations have operated haven't been really the avenue for that tribal voice to emerge. And I think there's some reasons for that, right? So first of all, recognizing that there are differences, that not in a way of separation, but rather in a way of celebration, that there are differences that exist in terms of communication, in terms of ways people come together and talk about these issues and about mental health. And I think the other thing is like the shifting the mindset to partnership, to really thinking about not I'm the expert or they're the expert, but we together have an expertise that can be valued and actually lead to better outcomes for our children. And as in our family movement, so to speak, in this country, kind of moving that family voice forward in all kinds of child serving systems, I think that's been the consistent thing, is that what are we providing to allow that to be an equal partnership in terms of support and training and welcoming, that voice, and being able to say, I really value all of the expertise that's in the room, right? And here's how we can do some of that. So again, I think there's all the kinds of things that have to do with outreach that are like, go to where you want to reach out to people. Don't wait until they come to you, find out in that community, what are the best avenues to connect to community? Is it through a faith-based, kind of situation? Is it through a cultural broker? Is it through, where do parents hang out in that community, right? All of those kinds of things, because when you get families together, we know that we're going to have that a percentage of those families are going to need the support that we may be able to offer, right? So, and the other thing I think that is an outreach, not a strategy, just, our approach is understand there's always a process of reciprocity. And that's what being in this role is about. So that means if you're reaching out, not just as that, with that colonized thought of being the helper, but what is it in this relationship that you not only have to offer, but what is it that you have to learn, right? So those are things that I think in any interaction, right, and in any engagement will lead to some better outcomes. And there's technical parts to engaging with certain populations too. So we can talk about that a little later.
Yeah. Okay, Anne. So what are some of the efforts and strategies for engagement in the past that you have learned from?
We think that it's really important for your organizations to have people that look like the population that you're trying to serve. So taking a look at workforce diversity, making sure that you are bringing into the organization people who can relate to the community that you're trying to serve. That's really important. We need to, I think, as well, take a look at where can we meet the needs of the families so that we are indeed empowering and supporting them. So taking a look at some of the fundamental skill building that you can do. You know, we base everything on data. And so how can we help families to better understand data so that if they are at these tables, they can be informed and understand what it is that is being discussed. What other resources can be provided to families to help strengthen those natural skills that they have, but also to help supplement the skill sets that they may not have. That are necessary in order for them to be able to effectively interact on groups. Again, you know, we have some comments that are speaking to behavioral health subcommittees, advisory councils. Here in Connecticut, we have a Children's Behavioral Health Plan Implementation Advisory Board. And I do have an opportunity to serve on that as one of the tri-chairs. But I raise it because at some point, we were able to, through the auspices of FREDLA, to do what they call their family voice assessment. And this is a tool that's available to take an internal look at your organization and help you to understand, like, where are there places that you can provide additional resources and supports to help family members to be more effective participants. We can sometimes see that a family organization might be brought in, and I think you made this point, Shannon, that you'll look to the handful of family organizations that they're used to seeing, but not necessarily capturing what is the voice, needs, or concerns of other family groups that are not represented by those organizations. So casting a wide net, but making sure that you are building a safety net under it and providing resources to strengthen family engagement has worked. Because when families are educated, family members are educated about the systems and how they work, and they find their power, that is where they can really then be active participants on those bodies and bring to the policy tables the perspectives that are necessary. Oftentimes what happens is we will see policies and procedures that are adopted, and the outcome will not be what it was designed to be. And we often will hear that was an unintended consequence. And I like to propose that in many of those instances, it's not an unintended consequence. It's an uninformed consequence because we didn't seek the input from those individuals who are going to be impacted by whatever that policy decision is.
Very good. I want you all now to think about the efforts that you have made over the last while. And Alice is going to put up a poll for us, and it's going to show us, let me see if I can, how well do you feel like the strategies that you have used, how do you feel like they have worked? So it looks like we are, well, not very well is catching up. Well enough and not very well is kind of neck and neck here. And that kind of tells us about where we think we are with our strategies and our efforts. Let's just give this a second more because we have a few more people here. Okay. So the results that when the poll ended was that most of you, 52% felt like it was well enough, but 43% felt like it was not very well. So that is kind of where we stand with that. I'm going to stop sharing again so we can go back to questions. So in the next section, if I can find myself here. This is the question we're going to ask. So what are some of the successes? And I'm going to put this in our chat so that everybody can see it. So what are some of the successes that you have tried? And I'll start with you, Anne, this time. What are some of the successes that you have had? And the participants, if you think about some things that have been successful, put those in the chat as well, and we'll talk about them as well. So, Anne, what has been successful for you in your outreach and amplifying these voices?
I think it's our ability to do some of those things that I had mentioned previously. Our organization, I mean, AFCAMP is an acronym. Our name is African Caribbean American Parents of Children with Disabilities. We started out as an organization that was formed for the express purpose of providing information and resources to families of Caribbean heritage in our local school system here, who did not have any idea about what their rights and responsibilities were under the Individuals with Disabilities in Education Act for their children with disabilities. And so I think that as we are able to see organizations that are led by people reflective of the population that you're trying to serve, that does go a long way towards it. I think that making sure that when you are creating your board of directors, that it is reflective of the community that you serve. You've been able to do that as well. Some of the other places where I would say we have had particular success is around reaching out and building strong networks, because there's really not any one organization that has all of the components to support the variety of needs of the populations. And so building strong community networks. I did hear Shannon mention faith-based organizations. I often look at how our systems of serving children's needs are designed, and oftentimes they'll go to this handful of selected providers or selected organizations that are supposed to provide the perspective that they're looking for or the services. But when there are groups that are not well served by some of those entities that are preferred, it is the neighborhood organizations that step in and do the services, provide for the families, connect them. And oftentimes those organizations don't even have a chance to compete for any of those contracts or RFPs that are geared towards evidence-based practices, but don't always pick up on the particular needs of a given population. So I think wherever we can influence that and have been able to influence that, it's been helpful. I did want to, if I might, go back to one thing that came out of the poll that you had just done, Lori.
Sure.
Comment in the chat, because what we came up with, if I'm correct, I think it was something like 52% well enough, and 47 or something like that that was not very well. And that was intriguing to me. And the comment in the chat was, well, is well enough good enough for our families? And I really would love to have any kind of feedback or comment on what does well enough look like when you are talking about services being provided to children with mental and behavioral health needs, with educational needs. What is well enough, and how do we settle for well enough for our children?
Very good question. Anybody in the audience have a thought about what does well enough look like? Some of you who answered well enough. You're welcome to unmute and speak up.
I guess I'll take a tackle at it.
Please do that. Thank you.
Where I look at it, well enough for me means I have enough, not enough resources, but I have resources that I'm working with, and I have social capital that I can build within. And I'm working towards being the ultimate best, right? And that I am connecting them to the best resources. I'm following up. But the reality is I'm living in a world where there's gaps in resources, but I'm aware of those gaps. And now my families are aware of those gaps, and we're fighting for those, with those gaps, for those gaps together. But well enough is because we have limitations. But I feel like I will be moving past that when my families and I can fight for those and fight through those limitations and barriers. Then we'll move from well enough. But I think because of, I guess for a lack of a better word, the glass ceiling for our families and the things that stop them from getting to where they want, we're doing it together though. So that's why I'll say well enough. If I was doing it by myself, I'd probably be further down that line, right? But being that we're doing it together, I feel well enough, and we're making sure their voices are being heard. So.
Very good. Thank you, Yolanda.
This is Debbie, and I'm the one that actually put that comment in as about is well enough, good enough. I didn't mean to offend anyone who,
Oh, no.
You know, please do not think that.
Yeah.
I am in a position where I'm a family representative at the table with providers, trying to get them to listen and understand that we need to have a voice in what's going on with our families. I also understand about, you know, we work with what we have, and I can appreciate that. It's just like the lady was just saying, it's so hard to keep striving for better when we always seem to get knocked down by policies, and we get knocked down by, you know, budgets, constraints and everything. It's very unfortunate that, and I live in a rural area just outside the capital of Florida, okay, who has practically nothing to offer families. And that's a shame. You know, it's pitiful. And I did not mean that the work that we're doing or anybody's doing is not good enough or not, you know, please take the comment as it was intended. You know, I want us to all, like the young lady was talking about, strive for better, strive for best. And it's hard in the situation that we're in our communities and in our job constraints. It's very hard.
I
would
agree.
like to thank both Yolanda and Debbie for the comments and for the perspectives. And actually took that comment as something that we should be asking policymakers when they make decisions that don't adequately fund the services that are needed, or that don't take to heart the input that is given to them by the family voices that are at their table. So you get invited and you get a chance to share your perspective, but it never gets translated into any policy or procedure or any change. So I really appreciate, and I appreciate the courage that you had to step up and share your perspective. So thank you very much.
Absolutely.
Thank you
Yes,
for
thank
letting
you.
us do that. Thank you for letting us do that.
Shannon, let's go to you and talk a little bit about some successes and challenges that you have experienced.
Yeah, I think I want to. I'll start with some of the challenges, and I really I have to be transparent that I came with the perspective of how do we elevate our tribal families' voices within these networks and get families engaged in not just death, that because I think there's something of value that's happening in what I call Indian country that could benefit the whole as well. And I think we miss out on that because of policies and structures. So for example, one of the barriers is it's not likely that you will find a family-run tribal organization, 501c3, on tribal lands, because they don't allow, many of the tribes do not allow a not-for-profit organization to be operating within their tribal lands. And there's a lot of kind of technical reasons for that. But what that means is a voice gets organized differently, right? And some of the things of culture then affect how we even think about family voice, as if it's not, because there is not the same sense of a nuclear family that happens in other communities. And so I think that's a barrier. Where I see it really successful engagement happen, and given all of the frustrations that we sometimes have with systems, and the way that we have to go in and really, have those conversations to try to shift those systems. In the meantime, a lot of times we miss what I call the informal authorities that are operating in our communities. They might be faith-based, like I was saying, Anne, but they might be others. There's other informal things that are happening within the community that have to do with kind of where you find that family voice and how you connect to that family voice. And sometimes we miss those opportunities, not just the opportunities in terms of the peer support, but the opportunities to really inform the systems about how to shift some of what they're doing. And I'll give you a really, a concrete example is that, in our northernmost tribal communities in Alaska, when they were having, a mental health youth crisis with suicide crisis, and imagine the ruralness of that tribe, that you have to actually get into a plane to deliver services to, or take the child out of the community to deliver some kinds of therapeutic services. What do you do in the meantime? You have to rely upon what is there in the community, and that's families. And so one of the interventions that they were using that was successful was to train the auntie, the gal who every kid after school went to their house because they had food in the refrigerator, right? And hung out there. They trained auntie as the gatekeeper, right? They partnered with a family member who could then, and then they supported that family member by making sure she could have food in her refrigerator for that intervention. These are powerful things that shift the way that our families, are experiencing things in our communities. And while, we need kind of that true two-pronged approach. One is to, to get within to the systems, to do the things that Anne was talking about in terms of how vital it is to have that voice, not only to contribute to the data, but then to help tell you what that data means. Because a lot of times we get that concrete and they can say, well, we see this percentage of parents say this, and we can give the context of yes, but not one of us is represented in that data, right? So how, those are the kinds of things that while we want to elevate all families' voices and engage all families, we have populations that aren't even at the table yet.
Very good. So one of the questions that you had put forth in our conversations before, Shannon, was why is language so important? And I think that is very much one of the reasons is language is so important, because they don't understand what's going on at that table because it's not in a language that they understand.
Well, and it goes both ways. I mean, it's systematic. Family members, every family member I know that has intersected with one system has likely intersected with 2 or 3 or 4 systems, right? And each one of those systems has their own language. We are linguists. We have to learn what every one of those acronyms mean, or in my case, I just make up new ones because now I'm like acronym, acronym heaven, what? But I mean, it is all about that. And the onus, why is it? I mean, this is true of any oppression or anything that happens. The onus is on us to learn the language. And and the other thing is that's a form of exclusionary behavior. If it's like the kids in school go over and talk in the corner and maybe they speak another language and they don't want anybody to know what they're saying, right? They make it inaccessible. And, and there's, it's one of those things that, and it's not a blame or shame thing. It happens when we communicate in a certain way with a certain group of people over a certain amount of time. It becomes part of the culture that we're ingrained in, whether it be in academia, whether it be in a family organization, right? And, or whether it is, I mean, every time I pick up the phone and I talk to my relatives across the border, my kids are like, they don't even have to know. They just say, who are you talking to from home, Mom? Because I immediately go into a Canadian accent. So, that isn't natural. So instead of spending all our time kind of like who's right or wrong in it, how do we move ourselves to the place of how do we create and develop together a language, them and us, right?
Right. So Anne, I wanted to ask you, when we're engaging with families who are underrepresented, what are some essential things to remember, including the language part and helping them to understand so that they understand what they're at the table for? But what are some other essential things to remember about engaging with those families?
You know, it's interesting because we often will hear that it's the families that have to be changed, or it's the families that that we have to prepare. But I would like us to get to a place where we can say that we have brought together a community of individuals, providers, professionals, family, peers, and the goal is this, that we have a shared goal. Because in many instances, the child's well-being it's the goal that's shared. But how we see ourselves getting to that is in very different ways. And so I would really be, and I try to encourage that what we have is more of a, where do we find that common ground that we can agree on, and then build on that to where we have some authentic partnership, some authentic collaboration. And so it's the starting point is from what is the best outcome for the child, and what is the best outcome for our family member, and where do we have commonality that we can build on. But that's not usually the starting point for many interactions when it comes to families. And you know, I'm struggling and I'm having a hard time with a lot of the adjectives that we use to describe our populations that we're talking about today. Underrepresented. Why? Why is it that they're underrepresented when in some of the circumstances, they actually are the majority? They are the numerical majority, but underrepresented. Why is that?
Miss Ann, I think sometimes that's because people that are right now in charge and large don't want to give up that driver's seat. They don't want other people to feel like they have power to do anything. They'd rather keep certain people where they don't feel like they can do anything for themselves, that they're the professionals, not the families. And I think that's so wrong.
Thank you, Debbie. And that's where any efforts that can be made towards equalizing that power, and education still is power if you can get a good one, which is another conversation altogether. But when we educate families as to what their rights are that they do have, when we do educate them around, you know, well, what do those acronyms mean, right? When we do help them to understand what the data is saying, and when they get to understand that you can look at data in a number of different ways and it can tell a different story. So really just giving our families the tools that the professionals already come to the table with, okay? Because they've already got that. Well, hopefully they have that. Okay? And so where we can strengthen families in any aspect of interacting with the systems, you know, I think that's where we need to be, because there won't be a power shift until we have parents and families at the table, but not just sitting at the table or not just being the meal at the table, but actually being at the table and in sufficient numbers and strength so that they can impact some of those policies, policy decisions that are being made.
So I just want to add that I think that it is critical to start with families where they are, wherever they are, and wherever they live, and whatever services that they're getting. But I think that we try then, when we get a family who needs services, we try to put that round peg in a, or that square peg in a round hole to fit the services that have been built, rather than building services around that round peg. And sometimes that becomes the challenge. And then families get lost because that's not helpful to them, right?
I think so, and that's where I think the value of wraparound services is really key. I also believe that that's a place where families can play key roles, because in those systems that are when you're truly developing the wraparound model, you're trying to strengthen the family. And so that's a place where we have seen success bringing in peer support to help the families, and using family members as peer support specialists and family peers and family advocates within the system, because he who lives it knows it, right? And so if you've been through that, you've lived through it, you can see aspects of the situation that perhaps your professionally trained individual might not be able to pick up on. But the other piece is that you're able to relate to the family in a different way. And you will look at the situation that they're in differently, and they will respond to a peer differently. So I think that putting wraparound models in place is a way that we can strengthen and support families, but that we can also strengthen and improve the provider systems.
Yeah, Donna says wraparound identifies strengths, individual family member strengths, and collective strengths, which is that is a good thing. Yeah, thank you. And Debbie says it would be wonderful if especially medical providers were required to have family navigators or peer support personnel in their offices. I know that is that has to be one of our outreaches as a family organization. That should be one of our outreaches, is to those medical providers, because that is where our families go first, right? I know when I had an issue with my son, I went to my pediatrician first, because that is what I know to be what I knew the process to be. And they need to be aware of those. I see Crystal has her hand up. Go ahead, Crystal.
Yeah, I have wondered over the years is that we never kind of explore with systems and providers how they feel about families and leadership, or like what are their biases that lie underneath in how they think about families, or why we're not invited to the table, or why it's so difficult, because it's not always policy. It's around those policies actually hide their fears and concerns, and so barriers get created. And it would be, I've always thought that we needed to start having some of those conversations, national, state, county, the local levels, to like, what is your concerns about bringing family into leadership roles, or what is your concern about them guiding what's happening in their own families, the family driven model. We can say, in Pennsylvania, counties involved in our systems of care statewide grant, have to have 25% family and 25% youth in county leadership. We very seldom have a county that even meets it. So there has to be underlying concerns. It can't, for 10 years, well, since 2010, I've been listening to we can't find families. Like we're not hiding. You're providing services to us. So there's got to be a key piece that we need to figure out, and as well as thinking about families, families involved in behavioral health and other systems. We're our own culture. We have many things in common, no matter where you're at, no matter what state you're in. We want what's best for our children. We want them to have a good life. We want them to be successful moving forward. And that has nothing to do with the region. That has to do with, so think of us as a culture within a culture that has subcultures. I always kind of think of that, and I tell them, families, we're a culture unto our own. You just think because we live in a certain county, we think about things differently. No, we don't. And I'm sure if we did a national survey, we would have some of the same answers coming up across the country.
Well, I think that there's a lot of talk about having families, in your case, 25% families and 25% youth, in leadership positions, but the barriers to getting them there is still the same. That doesn't change or hasn't.
Well, on the state level, we can do that. That's not a problem. Don't ask me why, but that's not necessarily a problem. But in the counties, there has to be some concern or fear around doing that. There has to be, because we're not that hard to find.
So Shannon, do you see that as the barrier or a concern in working with Indigenous people?
Well, yeah, I think, yeah. Again, I think there's two things that are happening. There's the assigned, Crystal, when you were talking, I was thinking about the assigned leadership, and then what's happening at like you were talking at the state level, but then what's happening at the community level. And yeah, I think that's true. I mean, we have different configurations in terms of helping people to remember that 80% of our tribal population live off reservation, off of tribal lands, and that means that they're in other communities, right? And they kind of disappear in that. And then I think that there's just always that, how are they being supported in the way that works best for families in that community, right? Even in our urban-based communities, for example, where would that support be delivered, right? Would it be at an Indian center, for example, or in Indian Health Services? What is the relation? If you don't know that, then your ability to outreach goes way down. So I think identifying those formal and informal leaders in those communities that you hope to reach. But I agree with Crystal. It's like it never ceases to amaze me when people say, "Well, we don't
find
know
the families."
we don't know where to, and we're like, right,
Right here. Oh, Shannon.
So, but it's, yeah, so it's, and I think absolutely strong enough around this. How do we get deeper to the attitudes and the beliefs that are did I, yeah.
You
I'm
cut out just a
unstable,
bit.
it says.
Yeah, you cut out just a bit.
Imagine that.
You did. So thank you for sharing that. We have about 15 minutes left. So I want to make sure that we get to the rest of our presentation, and that is, we've talked a little bit here about about working with families and bringing families and engaging with families and how important it is for them to participate. But I want to finish by talking about what the family organization's role is. And we talked a little bit about this as we were going through some of those questions, but I just want to hit this a little bit, that family-run organizations' role is to help families be fully independent and significant contributors. They need to have a safe and supportive place where they can receive assistance in any and all family roles. And then their connection to parent peer support is to help them learn how to access the types of supports that will be meaningful to their individual needs. I think when we trained parent peer supports here in Utah, we talked about if we can educate families to help advocate for their own family member, we would consider that a success. There are some who we feel like that is as far as they can go. It is really the family-run organizations or those who do this connection to parent peer support to identify those who are willing to move beyond that individual advocacy for their own families. So this connection should remain an option. This connection to parent peer support should remain an option throughout the duration of their services. Meet the identified needs of families is helping families navigate the various child serving systems to advocate for their own families, to make direct connections with providers. So it's important that the family-run organizations make those connections with the providers and help to develop their skills and knowledge, as well as the family peer supports that they work with. Did somebody have something to say? I don't want to miss anybody, so if you have something to say, feel free. In leadership development, family-run organizations recruit and engage with diverse family representatives and nurture their development as leaders to interface effectively in a variety of capacities. So we've talked about what some of those capacities are. It's really that family-run organization who helps recruit them and helps to teach them those leadership skills so that they feel like they belong at that table. And so that when you go and participate in a council or in a committee or in a policy, something or other, that there are people there who look like you, that there are people there who have the skills to be there and can show. We did a presentation a couple of months ago, like I said, on outreach to rural and frontier families. And one person said she knew she had seen success when the policies that were written in the language of her community, the language that her community presented to that group. So that is one way to show that success. Partnerships, to build partnerships, a family-run organization should have open, honest, and transparent partnerships with child-serving agencies. Partnership can be supported by providing incentives or reimbursements to participating families. And I heard or saw in the chat, somebody said, if we can't pay them what the other people that are around that table are being paid. And that definitely has been one of the barriers in years past. So going on to what are some other roles that family organizations can play? I would be interested to read your chat. If you could put something in the chat that it talked about what the role should be. I already, somebody has, Donna, thank you. It should be the role of the family organization to invest in families, helping them identify their strengths and directing them towards leadership opportunities in the local community and state, families investing in families. I love that. Thank you so much, Donna. That was lovely. Anne or Shannon, do you have anything to add to what other roles family organizations can play?
Yeah, I'm sorry. I apologize. My internet's a little unstable. I like that message when it comes across. You are unstable. I'm like, oh, that's
Thank you.
upsetting. So,
It's when you were feeling good about yourself, you get a message that you're unstable.
So we're all on a continuum, right?
Right.
So, but in terms of family organizations, family-run organizations, I think that what Ann put was important, that they are the conveners. They are the ones that can hold the space for families to come together. And I think they do have a role as a family organization to continue to do the outreach to reflect the population that is being served. So, really thinking about, as a family organization, what does your family run organization look like? Who's missing at that table that you need to hear from and be a part of the conversation? And and where might you, you as a family organization, begin looking to connect with those families from those communities, neighborhoods, and cultures that are not being represented?
Very good. Thank you. Anne, you put conveners. Do you want to expound on that? You're on mute.
I think that, we can just take a look at this afternoon and, the rich conversation that has been had, the different perspectives that have been changed. But I think that family organizations have been able to grow in their capacity to be conveners and to pull in other family organizations that might not necessarily have had the resources to be elevated to a place where they could be heard, where they could, as a group, wield some of the, or rather achieve some of the successes that the family peer movement has enjoyed over these decades, right? And so I think that it is something that my other comment that I put in there, another role of family-run organizations is to ensure that there's organizational sustainability. And that is important, because what we know is that this work is it takes a lot out of you, right? And it's not for the short haul, and it's not for the faint-hearted. And we have, I think, as family organizations, an obligation to be raising up those who will come after us, to make sure that the movement continues to grow, that it continues to become more inclusive and representative of the population, so that we can get to a place where we don't have to have a forum that is focusing on underrepresented, where underrepresented is intentional. Where can we focus on where it's like, okay, are we meeting the needs of most, and are there those that we are missing? But I don't think that that's necessarily the perspective that is taken. So I think that is another role that family organizations can play.
Very good. Thank you. Well, we have probably 5 minutes here for any additional questions that you might have as participants that you would like to ask either Shannon or Anne about their experience in working with families and amplifying their voices. Anything comes to mind, please unmute yourself and ask away. We only have a short period of time, so. So in the Donna put in just a reminder for system partners that responsibility for children's mental health care is dispersed across multiple systems. And that is every child serving system, right? So thank you for that reminder that doesn't matter what system your child is in or where you're looking, that is it. Also in the chat is the link to the survey for this particular session. And we use that to help market better, to help us be better about what we're presenting, that we're more clear, that we're getting to the information that you are all interested in. And so thank you for that. Any other questions that you might have to go? If not, we'll just finish a couple of minutes early. But I wanted to finish with the slide that I started with, is to being purposeful. And the important part about this is that everything that we do with families should be purposeful. And intentional is the word that goes along with purposeful. We need to be intentional about our outreach, intentional about amplifying the voices of those who are and may be underrepresented at the table, but certainly not underrepresented in receiving the services. So we need to be intentional about our outreach to those families. Next month, our presentation will be on Wednesday, April 27th. Hopefully it will be a nice warm spring day for most of you. We'll be talking about supporting families who support their youth who identify with LGBTQ+. Our presenters are from the Youth Acceptance Project at the National SOGI Center. If you're familiar with them, Evelyn Weeks and Leah Love will be joining us for that presentation. And on this slide is the link to register for that presentation. I want to thank you for attending, and we need to hear back from you, like I said, on that survey. I also want to take time to thank the NTAC folks, Alice, who is our tech on this presentation each and every month. She does a great job in keeping us in line and telling us or putting things in order the way that we need them to be. So thank you, Alice, for your time. And for NTAC for giving us the time to do this presentation. This is the slide that gives you some of the links to NTAC. NTAC is a place where you can get some free or almost free technical assistance. But if you are in any need of any technical assistance, you're welcome to go to that where the green arrow is and ask, and they will put you in touch with someone on their team who can provide the information that you're looking for. Let's see. So SAMHSA is the who funds NTAC, but SAMHSA's mission is to reduce the impact of substance abuse and mental illness on American communities. And we are thankful for their support in this presentation as well. So that would be the end of today. And thank you so much, Anne, and so much, Shannon, for your time and your effort and for all the hard work that you do and you blaze the path for us and help us shine the way to do a better job in our communities. So thank you all for attending, and we'll see you next month.